Hello, and welcome to Myths and Misconceptions, a series of short podcasts talking about social care jobs. We'll be joined by Alison and Neil to answer some questions about what it's really like to get a job in social care in Scotland.
Hello, it's Alison and Neil, continuing to talk to you about working in social care and putting to rest some of the misconceptions. And today we're going to talk about the social care crisis. It seems that every time you open the news or go onto social media, someone's talking about the crisis in social care, and this is all due to low pay. We hear a lot about social care workers being underpaid and with poor working conditions and terms and conditions. Is that true, Neil?
Being a social care worker isn't a minimum wage job. All frontline social care workers need to be paid at least the Scottish living wage. However, in recognition of the pressure that the sector has been under during the pandemic, the Scottish Government have increased this to a minimum of £10.02 per hour. And from April, we're expecting to see a further increase to £10.50 per hour. That's a minimum. There are other social care jobs that pay more than this, and social care employers will increase your pay as you gain more experience. Social care employers also provide good, secure, permanent jobs. We heard a misunderstanding recently that all social care jobs are done by agency workers and zero-hour contracts, but the majority of social care workers are permanent employees who work for one organisation only. Social care employers can offer zero-hour commitments to the people who want that, and there are agencies out there, but the sector mostly needs people on stable contracts to enable organisations to manage their rotas and, importantly, get to know the people that they support. Social care employers offer the same benefits that any other employer does for full or part-time work. Things like paid annual leave entitlements, recognition for additional hours such as time off in lieu of leave or extra pay, HR support, supervision and line management, and training. And actually, within social care, you probably get more training than you would do in other sectors.
You talked about social care employers, but surely social care is delivered by local authorities, so there's only one employer?
So that's not quite correct. Although local authorities do deliver some of it, the majority is done by lots of other social care organisations, independent, so private care companies, and also social care organisations that are in the voluntary sector or charities. But this doesn't mean that you don't get paid. You get paid just as you would do in any other job. It just means you're working for an organisation that is set up as a charity or a social enterprise, and it isn't designed to make an overall profit. Charities are usually values-led organisations, and that makes them great places to work.
Earlier on, you talked about all of the different types of jobs that are available. Do all social care jobs require people to do shift work?
So that can be true, but not everyone works on sociable hours. Shift patterns are different everywhere. Some roles will be 9 to 5, and you might find that that happens in maybe some mental health support work or within day centres. Other organisations might run rotas of 10-hour shifts, including an early shift and a late shift. There will be some that will include night shifts, and that could be a waking night shift, or it could be a sleepover. Every service will be different. If you can't work the way one service organised these shifts, that doesn't mean to say that it's the same elsewhere.
Thank you, Neil. When people look at the news or on their social media and all they see is that social care is in crisis, why do people actually come to work in it and stay?
Quite often, we have a picture of social care as these 15-minute domiciliary care visits, but it's not all like that. High quality support enables you to get to know people. Often, you have several hours with the person you're supporting, and you see them regularly. Lots of providers will try to match support workers with the interests and hobbies of the people they are supporting. There's a lot of variety and a lot of interaction. So if you ask support workers why they do their job, they will tell you about the impact it makes on people and how rewarding that is. There's great opportunities for teamwork. If you work closely with a team of colleagues to support the same person, you get to know them too. staff in lots of social care organisations have a great sense of community spirit and team morale. We've picked up one quote from a provider that said, "Last week we had a birthday party for one of the people we support, and one of my staff said, 'I can't believe we get paid to come to do this.'"
We've heard, Neil, that the pay in social care is higher than is portrayed in the media, and we've heard that there's a lot of job satisfaction, but we're still left with this portrayal of social care as in crisis. So what do we mean by that?
So, just like any essential service that's had to keep going through the pandemic, the last couple of years have been really difficult for social care. The sector needed investment before the pandemic, and now it needs even more investment. There's a lot of unmet need, which leads to all these headlines about crisis. However, for workers, this means opportunity because there are many and varied jobs available, lots of shifts and hours available, there's lots of opportunities to progress and train, and there's pressure for wages to go up for social care workers so they receive more recognition as professionals.
Thanks, Neil. The narrative is that social care is in crisis and the work is poorly paid, but as you've just heard, social care jobs are paid currently above the Scottish living wage, and the jobs are rewarding and bring a lot of job satisfaction. They also bring the opportunity to build relationships with the people you support and with your colleagues. They're mostly permanent jobs with formal contracts, even if what we hear makes it sound like it's all insecure casual work. And the sector's growing. The crisis we hear about is because we need more staff, not because jobs are at risk. In the next episode, we'll look at some stereotypes about the social care workforce and who they are, as well as the career opportunities on offer.
You've been listening to Myths and Misconceptions, a podcast by the Coalition of Care and Support Providers in Scotland, with music by Melody Loops and content contributed by social care providers from across the third sector.